Thank you, Dr. White, for the opportunity to speak here today. Good morning, ladies and gentlemen. My name is Kelly Turner, and I'm going to speak for the topic, people who are smokers should not be employed. Should employers butt in? Our team thinks so. The war on smoking is proceeding with rapid progress, and why shouldn't it be? Smoking is a terrible habit, which the effects of smoking are well documented. Smoking causes many different cancers, as well as chronic lung disease, such as bronchitis and emphysema, heart disease, and many other serious health problems. Furthermore, smoking has begun to hit businesses where it hurts, their bottom line. Employers who smoke impose significant excess costs on their employers: absenteeism, loss in productivity, and healthcare costs, to name a few. This alone poses a serious economic burden for many companies. So why do companies hire smokers at all? We, the Affirmative team, believe that it's time people who smoke should not be employed. The movement to promote smoke-free workplaces for all employers began in 1971, when it was declared that non-smokers have as much right to clean air as smokers have to their so-called right to smoke. In 2008, 6 Australian states and territories banned smoking in workplaces, including bars and restaurants. In recent years, we are now seeing a new trend in workplace smoking policies emerging, a shift from smoke-free workplace policies to what have been termed smoker-free workplace policies. In 2005, the World Health Organization became the largest international employer to ban the hiring of smokers in an effort to promote its public health campaign against tobacco use. We believe that implementation of a workplace policy barring employment to smokers will lead to positive and beneficial outcomes for both smokers and businesses. If we can reduce smoking rates by all acceptable and effective methods, including banning smokers in the workplace, then it is reasonable to assume that this will lead to greater population-wide health benefits and financial benefits to businesses. Our team will successfully argue that smokers have a higher absenteeism rate than that of their non-smoking colleagues, and that it is in the smoker's best interest to quit. Our second speaker, Alexandra, will demonstrate that productivity amongst smokers is significantly less, the high cost of smokers to their employees and the health system, the impact that employing smokers could have on encouraging others to also take part, and the damage that smokers could have on the company's reputation. Alex will also question how drug and alcohol testing is prevalent and is a dismissible offence in many companies, but not smoking. Our third speaker, Deborah, will discuss whether it is ethical to employ smokers on the basis that it is financially enabling them to continue smoking. Our fourth and final speaker, Matthew, will provide compelling information on the extensive amount of research that has been conducted to support our arguments. I firmly speak for the proposition that people who are smokers should not be employed on the basis that smokers take more sick days than their non-smoking co-workers. A study in the UK showed that approximately 50 million working days are lost each year due to smoking. This figure is simply staggering, and not surprisingly, several other studies conducted in many countries have found that smoking increases both the risk and duration of absenteeism. For example, let's take a look at the systemic review by Wang et al. In 2013, which concluded there was consistent evidence that current smokers were on average 33% more likely to be absent from work than non-smokers. They also found that when current smokers did take absence, they were absent on average 2.74 more days per year than non-smokers. Now let's take a brief look at the argument. It's for employees' own good. Finding employment in modern society is becoming increasingly difficult, particularly for smokers, due to the fact that smoking is no longer considered socially acceptable. In addition, the impact of cigarette smoking on health is well understood, with current smokers having a mortality rate 2 to 3 times higher than the non-smokers, and so the health benefits of reducing the proportion of smokers is clearly evident. So in terms of employment and health benefits, smokers would be, well, better off not smoking. Take a moment to consider these arguments so far, and already, isn't it clear that people who are smokers should not be employed? Smoking is a terrible habit that poses a serious economic burden to companies and smokers themselves. The evidence is confounding, as you will hear from the following speakers, that it is time all businesses take the lead from the World Health Organization, take a stand and ban employing smokers. Thank you very much.